Dr. Shraddha Deshpande. I'm a consultant plastic, reconstructive and aesthetic surgeon with Wokhar Hospitals, Mumbai. Today I'll be talking about the treatment of diabetic foot ulcers. Now the treatment of diabetic foot ulcers depends on the grading of the diabetic foot ulcer. Grade 0 is the foot at risk. This foot is having dry skin and structural changes. For this, we need to treat the skin with moisturizer and good foot hygiene. And for the structural changes, we need to give appropriate footwear for such patients. If there are corns and calluses, we need to treat those. We need to excise the corns to prevent their progression into ulcers. A grade 1 is a superficial ulcer, which is involving only skin. The appropriate treatment for this is cleaning, debridement of the wound and treating with various topical agents, certain creams, and there are certain biological agents like growth factor concentrate, which we can also use for treatment in these cases. Also, along with it, we need to use appropriate footwear. For grade 2 and grade 3, which is exposed tendon or exposed bone or even involving osteomyelitis of the foot, we need appropriate surgical debridement. Appropriate antibiotics may have to be given for certain cases along with topical applications, or it may require a surgical closure with flap surgeries for treating these cases as well. Also, along with it, in our hospital, we are using a novel technique, which is the use of growth factor concentrate. Now, growth factor concentrate is something which is obtained from your own body, your own blood cells. These are rich in the epidermal growth factors, the platelet derived growth factors, and they act directly on the wound and help in the epithelialization and faster healing of these wounds. So, if you want to know more about this, you can definitely get in touch with us for the growth factor treatment. Now, as we know, the grade 4 and the grade 5 is gangrene, which is the grade 4 is localized gangrene and the grade 5 is the gangrene of the entire foot. In these cases, when there is already the damage has been done, there is no other treatment but to amputate those areas. It may involve toe amputation in case of grade 4, which is the involvement of a localized area, or it may involve amputation of the entire foot. So, we would want to prevent the amputations and the progressions of the ulcers into the grade 4 and grade 5, and we want to catch these diabetic foot wounds early so that we can treat them and we can save the foot. So, to know more about our novel GFC treatment as well as the various treatments that we at Wokhar Hospital offer in form of advanced wound care, you can get in touch with us with the numbers which are given below, and we will be happy to guide you. Thank you.